already at the wall, I outlined all of the different anatomical movements. And one of the really interesting movements that we have in our body is this rotational movement that happens at the forearm. So we have pronation when we turn the palm down, and then we have supination when we turn the palm up. And I always remember this because you would carry a bowl of soup with your palms up. It's the silly little thing that helps me to remember that. So when we're trying to work on these two movements, we don't do a ton of this in our yoga practice, but the wall gives us a really nice opportunity to explore these movements, and then we can take it down into that weight-bearing position again. So I'm going to start out with the palms down, which is kind of our normal position, right? If we were going to do dolphin pose, we're like this, pronated, and then I'm going to push the thumb very actively into the wall. And I start to feel that in my upper back as well, which is a really interesting activation. And then I'm going to start to flip the opposite way and then push my thumb out towards supination. Very active. Use the wall for resistance. Hold it. Feel the upper back engage and then flip the other way. Push into the thumbs. Good. Push into the thumbs. You can try this at different angles. It's always nice to explore the movement this way or that way. That one feels really interesting when I go into supination with the shoulders externally rotated. Really cool. So play around with that. See where you can work that in and then take that down onto the mat. And do the same thing. Push the thumbs out, flip the palms down, drive the thumbs down into the mat. See what muscles you can notice activating when you do that. So now let's look at some of the other wrist work that we can do when we're at the wall. Flexion and extension of the wrists, we can do that at the wall without having quite as much body weight. Like sometimes we will do this in table during yoga practice to like stretch out the wrists, but for some students that's way too much pressure on the hands and it will actually cause wrist pain because it's a little too aggressive. So that's a situation where the wall would be perfect because you're totally in control of the pressure that you're using. So I'm just going to show you with one hand because that'll be easier. I'm going to go into extension with the wrist. This is also helpful because some people won't have 90 degrees of extension, so you can really play around with whatever degree of movement they have. And then I'm going to go into flexion. And right now I'm doing this with a bent elbow, but it's going to feel very different if I switch and do this with a straight elbow. Just make sure that the shoulder doesn't hike. I'll start to slide the hand down the wall to change the degree of extension. And then when I'm doing my flexion stretch, I'm going to move the hand up the wall to change the degree of flexion until I get that perfect amount of stretch. Okay, so the other thing that we'll do sometimes on the floor are these little flexion extension rolls with the fist to get some strength in the wrist muscles. If it's too much doing it on the floor, come up to the wall and try it this way. So I'm going to drop the back of the hand and then pull the dorsal side of the hand away from the wall. Pull back actively. Not as strenuous as doing this on the floor with full body weight, but it's still going to give you some strength to relax and then actively pull back toward extension. Okay, the other way that we do this sometimes is for radial and ulnar deviation. So radial deviation toward the thumb and then ulnar deviation toward the pinky. But we'll do this sometimes with the fists on the mat and kind of rolling forward and back with our body weight on the arms. If that's too much, we come up to the wall and we can do this radial deviation, ulnar deviation. The way that we manage body weight at the wall is our foot position. My feet are right underneath the body, not as much weight on the arms. If I move my feet back away from the wall, I can put some body weight into the hands while I'm doing this. Makes it just a little bit more strenuous, gives me a greater degree of strengthening, but without being too much. Okay, so the other thing that I like to talk about with the hand is there's so many different ways to place your hand against a surface, whether we're at the wall or we're at the floor. sometimes we do this kind of limp hand thing where we're going into a pose and we just place the hand down. And then most of the strain is going to be in the shoulder, in the elbow, in the forearm, and the wrist. The hand muscles are just hanging out. They're not really helping us. But the hand muscles are so important to creating that foundation, that active connection, hasta bandha, hand lock, to whatever surface we're engaging with. And the wall gives us this perfect place to practice. So I'm going to start by spreading my fingers, finger abduction, opening up the space in between the bones of the hand. And then I'm going to engage the tips of the fingers, like I'm gently holding onto the wall. And right there I can feel all these muscles in my hand and in my forearm. I'm going to squeeze my forearm a little bit because those muscles are tight. They're working. And I think of this as like a frog hand. If you see those little sticky pads on a frog when they stick to glass, that's the kind of thing that you're trying to create here with the pads of your fingers. But then the center of the hand is your suction cup that's pulled away to create that arch of the palm. And we know arches create strength. So arches of the feet, arches of the palm are very important when we're doing weight bearing. Okay, so we create this hasta bandha. Fingers engaged, palm pulled back to emphasize the arches. Hand muscles actively engaged into the wall. Okay, so then the last one that we're going to look at is the ulnar and radial deviation with the palm flat on the wall, or you can do this on the floor too, like many of the other things. I'm going to stick my hand onto the wall. I'm going to keep my forearm still because I don't want this part of my arm to compensate. I'm going to go thumb side, radial deviation, pinky side, ulnar deviation, back and forth, back and forth. This is going to give me some lateral stability in the wrist. And of course we could do this with both hands in and out. Like that. The other hand position that I like to use when I'm working at the wall is what I call a tented hand position, or sometimes we'll call it a spider hand, because the palm is actually pulled away from the wall. So we start like that. I'm going to pull the palm up and away, and it's fingertips that are resting against the wall. This kind of a shape with the hand. Very, very active. You cannot do this with a soft, limp hand. It's a very strongly engaged position. And this works great when we're doing things like using the hand to twist and we want to keep some activation through the fingers, or when we're doing something like a wall hang and we're trying to keep the fingertips engaged into the wall. So you have that kind of regular relaxed hand. You have the hasta bandha where the pads of the fingers are activated and you have that suction cupping effect with the center of the palm. You have the tented fingers. And then of course, if you have sensitivity in your wrists, and I've done this at different points throughout my years of practicing yoga where my wrist was bothering me, you can trade that out to go onto a fist, and then when you're in a fisted position, it gives you this surface to rest on without putting the wrist into flexion or extension, radial deviation or ulnar deviation. So it's neutral and it's stable, and usually that will keep your wrist pain to a minimum, and that would just look like using the knuckles as a support, like that. And I can do some plank work there, because a lot of times having the wrist in extension and doing work in your plank can flare up wrist pain. So this is a very nice option to modify in any sort of weight-bearing position. So think about the way that your hands are tied into the rest of your arm. It's all attached. There's this whole cause and effect that goes from joint to joint all the way up through the arm. And the way that you engage your hands in a pose is going to have an impact on the way that all the other muscles in the arm engage, the way that the shoulders stabilize. So really pay attention to what your hands are doing during your practice.